Good day, I'm Jacqueline Magrano from BSN3C of Nueva Ecija University of Science and Technology. And for today's return demonstration, I will be inserting nasogastric tube and I will be introducing nasogastric feeding to a patient. So this is done so that we can give them the extra nutrients and calories that they need. Furthermore, this is given in clients who have difficulties in swallowing or are unable to swallow a sufficient diet without aspirating fluids into the lungs. Moreover, this is the establishment of gastric or suctioning gastric contents or the stomach contents to prevent nausea, vomiting, and gastric distension. So for the assessment, assess the doctor's orders so that we can determine or so that we can avoid doing things that can be harmful or dangerous to the patient. Then second one is to assess the client's level of knowledge, understanding, and the level of consciousness. Assess the client's or the availability and the functionality of the materials needed. And then check for history of previous nasal surgery because there is a tendency that it can be punctured during the NG insertion because of the deformation in the nasal area from previous surgery. Then assess the patency of the nares so that we can determine which side is most open and we will know where are we going to insert the nasogastric tube. Then after that, assess the client's or assess the gag reflex of the client to prevent aspiration. Then assess the client's mental status and ability to cooperate. In cases when the person have autism, there is a tendency that the tube can be easily dislodged or moved by the patient. Moving on to the planning, before inserting a nasogastric tube, determine the size to be inserted and whether the tube is to be attached to suction. It is necessary because we have different sizes in varying age or in different age group, such as in toddler, infant, and adult. Then prepare the equipments needed, such as the large or small bore tube, non-latex is preferred, non-allergenic adhesive tape, clean gloves, water-soluble lubricant because it is easier to absorb or dilute which prevents aspiration, facial tissues, glass of water and drinking straw, 20 to 50 ml syringe with an adapter, basin, pH test strip or meter, bilirubin dipstick, stethoscope, disposable paper towel, clamp or plug which is optional, anti-reflux valve for air vent if solid sump tube is used, suction apparatus, safety pin, and elastic band, and then the CO2 detector which is also optional. So for the implementation, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do and why it is necessary. Then assist the client in a high Fowler's position for easy transportation of food. Then support the head of the client using a pillow. Place a towel or a disposable pads across the client's chest. Then provides for client privacy by closing the door, pulling the curtains if client desires. Then after that, perform proper hand hygiene or observe other appropriate infection control measures such as the use of clean gloves and hand washing. And then place the towel across the client's chest. Then provide for client's privacy by closing the door and pulling the curtains if the client desires it. Perform proper hand hygiene. So, assess the client's nares to determine which side is most open, prepare the tube, support the patient during the procedure. Then determine how far the tube to be inserted. Insert the tube to mark out the distance from the tip of the nose, then from the tip of the nose to the tip of the earlobes, then from the tip of the earlobes to the tip of the xiphoid. This marks up the distance from the nares or the nares to the stomach. Then use the tube to, if the tube does not have any markings, we can use adhesive tape to mark it. Then lubricate well or insert the tube, but before that we should lubricate it well with the water-soluble lubricant to ease insertion. Then insert the tube with its natural curvature towards the client into the selected nostril. Then ask the client to hyperextend the neck, and then gently advance the tube towards the client's nasopharynx. If the client gags during the procedure, stop momentarily. Have the client rest, take a deep breaths, and take a few sips of water to calm the gag reflex.
Tube towards the client's nasopharynx. Ascertain correct placement of the tube by aspirating stomach contents to check the acidity of it. Then confirming it by X-ray or by placing a stethoscope on the client's epigastrium. While injecting 15 to 30 ml of air.
Evaluate the client's response to the procedure, then document the procedure and other important details to the client's chart.